Hi again. Today I wanted to talk about some of the thought process of how to choose a Part D plan. As you probably are aware, choosing health insurance is kind of like it's gambling, basically. You're trying to decide what your risk comfort is, and based on your situation right now, you're guessing what your situation is going to be in the future and what your financial situation is and what you're comfortable risking, and hoping for the best. But I've got three examples of family member friends, and how we decided based on their circumstances on what kind of a plan to get. The first example is someone who didn't like taking risks and wants things to be covered. So she's paying a higher premium for kind of a premium plan. She's paying a higher premium of about $105 a month, but she doesn't have a deductible. And her drugs, all the ones that she's on, are covered. Her copays are $5, $10, or $45. That's for a preferred brand. So that's a really good plan, and she does really well until midsummer when she hits the donut hole. And so when she hits the donut hole, that's about a 25% then of the drug cost that she has to pay, which can, be $100 or more for each medicine that's a name brand. Luckily, she's eligible to get patient assistance on some of those through the drug company, but otherwise she has to pay a higher price till the end of the year. So that's the downside of that plan for her. If you aren't on a lot of expensive drugs but are on name brand drugs that are expensive, it might be a good plan for you. The second person was on a plan like that, but she was having a really hard time affording it. And when it came down to it, and I looked at her drug list, she wasn't on any brand name drugs. And so she was actually paying more for the generic price of her prescription coverage copay than some of the drugs actually cost if you got it just at the drugstore through their savings plans. So we decided that she might be better off going to a cheaper plan, in which case her premium is something like $13 a month, which is a huge saving per month, but she has a $480 deductible, which so far has not been a problem. But should she need a brand name drug now, she'll have to pay that. And the key is to set aside some money, or have a family friend or a family member or someone who's willing to pay for that amount if that happens during the year. But her copays are $0, $4, and $42 currently. So if she were to pay that deductible, her copay after that would be $42 for a brand that's preferred. Right now, she's doing really well on that one. So the third person is someone who's only on a few inexpensive generics, and recently ended up also being on a brand name drug, but that she qualifies for patient assistance for. And so she has chosen to not get a Part D plan at all and not have to pay that premium every month. And so far, she's doing fine with that. She's got her brand name drug through the drug company, through the patient assistance for free. And then she is getting her best deal at multiple pharmacies. So for each drug, she goes to Publix or Kroger or Walmart or wherever and uses their savings program or a program like GoodRx and gets the lowest price that she can on each of the prescriptions that she's on. And so far, that's working for her. The downside for her would be that should she in the future need to get on a Part D plan because she's on multiple drugs that are not otherwise covered or are too expensive for her to afford, then she's going to pay a penalty for each year she did not have a Part D plan. So that's the downside of that. But for her case, because her income is low enough, she's probably better off. She's probably better off, we think, doing what she's doing because she does qualify for patient assistance for most drugs. So if you want to keep those things in mind, so you want to think about your premium, but also your deductible, what your co-pays are going to be. I think I mentioned before, a lot of plans have co-insurance rather than co-pays for your brand name drugs, and that can make a huge difference because we have patients who are paying $100, $150 for their normal monthly co-insurance, and a lot of times that's after paying a $480 deductible at the beginning of the year. So I would stay away from those plans. But we don't know yet what the plans are going to look like for this year. We will know really soon. But if you have any questions, put them in the comments. And I hope this helps a little bit.